Hi, I'm Dr. Brenner. Thanks for considering having your cataract surgery with me. I'm going to talk to you a little bit about the procedure today and the different options that you can choose from. A cataract is when the natural lens inside your eye gets cloudy with age. When you're born, this lens is clear and flexible, and at some point in your 40s, this lens became stiff, and that's when everyone starts to need reading glasses. And then further along the spectrum, that lens starts to get cloudy, and when it gets cloudy, that's when you start having more trouble with your vision. It's kind of like looking through a frosted or dirty window all the time. So the goal of cataract surgery is to take out this cloudy lens and put in a clear one. And when we put in that clear lens implant, there are lots of different things we can do to help reduce your dependence on glasses to some extent, and we're going to talk about that. The procedure itself takes about 15 minutes. It's usually done in an outpatient surgery center. We give you some anesthesia through the IV to help relax you and numbing medicine on the eye, but you don't need a breathing tube or anything like that. And that's why the anesthesia is so low risk, and the procedure itself is low risk. So you don't need to go see your primary care doctor beforehand for clearance in most cases because we're not doing really heavy anesthesia for the procedure. You go home after the surgery, come back to the office the next day, we check and make sure that your eye looks good. Most people already see better the next day, and usually things are pretty well healed within a week or two. Recovery for most patients is pretty straightforward. You can go about most of your life like normal. The big things we want you to avoid are swimming in public water. We don't want you to get the bacteria in your eye, and we don't want you to do anything where you may get hit in the eye, and try to keep lifting light for a couple days. We do give you an eye shield to wear at bedtime to help protect that eye for a week, and after the week you don't need to use it anymore. Once both eyes have healed, we take some measurements to see what you do and don't need for glasses, and then you can go back to your normal eye exams like normal. The lens implants are made of plastic. They don't wear out. It's not like a hip or a knee that has friction on it, so that lens implant is generally good for life. It can be replaced if needed, but it's pretty rare that we have to do that. Now, when it comes to general risks of surgery, this is the most common procedure done around the world, so we've gotten pretty good at it, but every surgery has risks. The main things we worry about are infection and inflammation. We do give you medicine at the time of surgery to help prevent that, and sometimes we may give you an eye drop after surgery, depending on your specific situation. But for most patients, they're doing what's called dropless surgery now, which is nice because most people told us that their least favorite part of the surgery was doing the eye drops afterwards. So we, to some extent, fixed that problem. Other things we watch for during surgery, little pieces of the cataract falling into the back of the eye. If it's a small piece, your body will just absorb it, but sometimes if it's a big piece, you need a second procedure to remove it. That's pretty rare. And we also look for problems with the retina. The retina is like the film of the camera. You can have swelling or tears in the retina. It's pretty uncommon, but we watch for these things because we can manage them as long as we catch them. So this is why we have you come back to the office for a couple visits after surgery. Like I said, overall, this is the most common procedure done around the world, so it's become very safe and effective, and overall the risk is quite low. Now, when it comes to technology and options, a lot has changed with cataract surgery, and there really are 3 different ranges of vision to consider and 3 different options for surgery to consider. Vision really is distance, which is driving your car, watching TV, looking across the room. Intermediate, which is your computer, your grocery shelf, your dashboard, which with technology has become more and more important to people, including tablets and things like that. And then your near vision, which is looking at small print up close, knitting, small print on a pill bottle, those kind of things. And because these lens implants are plastic and don't change shape, we either have to wear glasses for some range of vision, we can't get every range, or we have to mix and match these lenses or use multifocal lenses to help get you more depth of focus. So in traditional surgery, we put in a single focus lens implant. It will focus you either for distance or intermediate or near, and you put on glasses for the other range. We take measurements beforehand to predict the best size and power of lens to put in, and that's accurate about 60% of the time or so. And the reason sometimes you still end up with a little bit of prescription left over is because there are variables at play, including healing and astigmatism and the final place of the lens in the eye that are hard for us to predict. In the second option, we use a laser to assist in surgery. The laser helps correct astigmatism, and by correcting astigmatism, it makes your overall quality of vision without glasses better. This is very common to have some degree of astigmatism, which is where your eye shape more like a football than a basketball. And if we correct it, overall your quality of vision will be better. We can also use a laser to help fine-tune things after surgery if needed, and we can use the laser during surgery to help do some steps of the procedure. It will open up the cataract, break it up into little pieces and soften it, and makes it a little bit gentler on the eye. So all of this technology using lasers helps increase the accuracy of surgery, as well as make some steps of the procedure a little bit more predictable. The third option is to put in something called a multifocal lens implant. These are lenses that help you see both far away and up close in both eyes at the same time. And really the way these things work is it looks like a target sign or a bullseye. It has rings that do distance and rings that do near. And overall your brain figures out which ring it needs to look through at any given time and give you simultaneous vision in different ranges. And so these lenses work well, but they're not perfect. It's not like the lens you were born with when you were 20 years old, where it actually changes shape to give you these different focal points. So some of the trade-offs of having both distance and reading vision without glasses is that you may see halos at nighttime. That's looking at a headlight and seeing rings of light around it because there are rings in the implant. And most people find those halos not to be too bothersome, but a small percentage of people, somewhere around 3%, it really drives them nuts and they say, hey, can you take this lens out? We can do that. We can take you back to the OR and exchange the lens, but every time you do surgery, there's risks, so we try to avoid that. The other thing to know about multifocal lenses is that they really are splitting light. They're sending some light from distance and some light from near. So people with multifocals in certain lighting conditions may notice that they don't have the same quality of vision as they're used to when they had glasses on, because you really do need a lot of light to do some of these things. But for people who really want to be free from glasses, most people find these trade-offs to be worth it, and so most people are pretty happy with multifocal lenses. No matter which lens you pick, your vision will be better because you are going to have a clear lens instead of a cloudy one. But these options, what we call option 2 and 3, are allowing you to be more free from glasses. And for many people, they want to take opportunity of doing cataract surgery to reduce their glasses independence. Anything we do to reduce your glasses dependence is really not covered by insurance, because honestly, they don't care if you have to wear glasses or not. They just want you to see well with glasses. So when you come in for your evaluation, we'll talk to you about the different options, the different costs, and how you can finance them if you want to do that. And then we'll help you decide what is the best option for you and for your future vision. Thank you for considering having surgery with me, and when you come in for the evaluation, we'll give you all the different options and go over this again.